Good morning. I'm Dr. Adamu Muhammad Ewa, a consultant gastroenterologist with the Federal University Teaching Hospital, Lafia. Today is 28th of July, the day that the World Health Organization set aside to celebrate World Hepatitis Day. It is celebrated every year on 28th of July. For this year, the theme is hepatitis. Let's break it down. And what that means stands to remove every barrier that stands in the way of preventing hepatitis and barriers that are there towards testing. It's expected that with this theme, barriers to prevention and testing for hepatitis will be removed. Then there will be provision of treatment and care for patients that test positive to viral hepatitis, and also to try to eliminate hepatitis, going by the 2030 WHO elimination target for viral hepatitis. Hepatitis refers to just a disease that affects the liver, and there are a lot of things that can affect the liver and cause hepatitis. However, top on the list are viral infections that affect the liver, hepatitis B and C. These are infections that affect the liver and can cause problem in the short term and in the long term. So for hepatitis B and C that are troublesome, that we have a lot of people coming down with it, there are infections that can be prevented. And with basic knowledge, basic health awareness, people should know how to contract this disease, how to prevent themselves from getting this disease. Ways in which people get infected with hepatitis include through unsafe sexual practices. When one have sexual contact with somebody that has hepatitis, there are risks that he can be infected. Then through blood transfusion, where blood were not screened properly, hepatitis can be transmitted. If the donors were not screened and they have hepatitis, it can be transmitted to the recipient of that blood. Then also use of sharps, indiscriminate use of sharps. If a person that has either hepatitis B or C has used any sharp object, and then another person takes it and then uses it on his own self or another person, there are risks that he may transmit infection. And these sharps include needles, using a needle for one patient and using it for another person, or people that inject drugs. They use it, one person uses it and gives it to another person to use. Or people that go for tattoos and other body piercings. Those instruments, if not sterilized, if they are used for one person and then they take them and use it for another person, it can be transmitted through that way. So hepatitis is just something, when it comes to transmission, it's just basically the same ways that somebody can get HIV, then those are the same ways in which hepatitis can be transmitted. So how do people, what can people do to prevent themselves from having hepatitis? One is health education. That's why we're offering that as the first thing that we're going to do to mark this day. We intend to raise awareness about the disease. It's only when you know about something that you will tend to try to not get infected with that disease. So it's important that people seek knowledge and people listen. People come to gatherings in which health topics are going to be discussed, in which hepatitis will be part in most fora. Then after knowing that, the next thing is for people to know their status. Once you are aware that there is a disease like this, then you need to get tested. And it's only after the testing that we'll know whether you have it or not. And if you don't have it, then we'll offer you vaccination for hepatitis B. Hepatitis C has no vaccination. So it's important that everybody remains alert and prevent himself from coming down with that. That has treatment. So for those that tested positive to either B or C, we will evaluate them further and offer them treatment services to prevent them transmitting to other people. Hepatitis, as I've mentioned earlier, is something that affects the liver, as I said. It can present in many ways. There are a lot of people that are going around with hepatitis because the most common symptom of the disease is somebody being asymptomatic, not showing any sign of the disease. It's only when you get tested that will know that you have the disease. However, if the disease has now started progressing, then people will start coming down with signs, with symptoms to suggest that they have the disease. And this may include something like presenting with yellow eyes, or coming with abdominal swelling, someone's skin becoming darker, or somebody vomiting blood, or passing blood, or dark stool. These are some of the common things that patients with hepatitis may come with. So at that stage, if they come, we'll evaluate them and see what is the best treatment that they can get. And I said hepatitis is something that can be asymptomatic, meaning somebody can come without symptoms. However, it can be severe, such that the patient may come at the late stage of the disease, in which it can cause a liver cancer, which is the most worrisome outcome of the disease. So it's important that people prevent themselves from coming down